My name is Dan Derksen. I'm the Associate Vice President for Health Equity, Outreach, and Interprofessional Activities. I oversee programs including the Center for Rural Health and the Area Health Education Center program in Arizona. There's a number of models that we draw from. I showed you in the first illustration what is meant by interprofessional education, team-based care. In the second illustration, I really want to turn to some of the things coming out of the National Academies of Science. This is a framework for educating health professionals in the social determinants of health. The World Health Organization defines the social determinants of health as the conditions in which people are born, grow, live, work, and age. And these are shaped by the distribution of money, power, and resources at global, national, and local levels. So a lot of our work here in interprofessional education depends on this framework that focuses on the social determinants of health. And that includes a different kind of education, the experience that we're hoping you'll get here in experiential learning, in collaborative learning across health professions, but also a curriculum that's integrated to give you longitudinal interprofessional education experiences. We'll have large event interprofessional experiences like pandemic flu, but we also want to create a menu so that as you go through your health professions training, you can pick and choose from that menu so that you're best prepared for where you envision yourself in practice, hopefully in the state of Arizona. But it also includes a supportive educational institution like the University of Arizona Health Sciences and a real vision for incorporating the social determinants of health all the way through our education pipeline, from pre-professional and K through 12, into the health professions education, whether that's nursing, pharmacy, medicine, public health, but out into the community as well, and continuing education going on. And that commitment we have as a land-grant university at the University of Arizona is a reciprocal engagement that our faculty includes those field faculty out in communities that accept our students in these community-based interprofessional activities, and that we engage the community not only in the service side, but the education and the research side as well. So this encompassing view really gives you a framework for that. This was just approved in January of 2020, a strategic plan that incorporates interprofessional education, whether that occurs on site in our Aztec Simulation Center, or that occurs in our clinical and professional skills in the Health Sciences Innovation Building, or that's community-based interprofessional education that occurs through our Arizona Area Health Education Center programs, or that occurs online or virtually through continuing education activities. These are brought together and illustrated in that third illustration as the components of interprofessional education interwoven integrally into our strategic plan for the health sciences. And then the last slide really illustrates the components of that, bringing together interprofessional education with the social determinants of health education that the National Academies of Science brought together across the things done in the building, the Health Sciences Innovation Building, through simulation and clinical and professional skills, community-based through our Arizona Health Education Centers, and through our Center for Rural Health. So these components are very important. This is the underpinning of what we're talking about when we're talking about interprofessional education at the University of Arizona Health Sciences.